Welcome to Reducing Risk, a series of podcasts from Medical Protection created specifically for doctors in Aotearoa, New Zealand. Reducing Risk looks at key medico-legal issues in our jurisdiction and provides helpful advice and guidance on how to manage those risks. Today we're presenting part 2 of a 2-part series on building resilience and physician well-being. Burnout is common and it often sneaks up on us and in some cases can be devastating. The numbers aren't very encouraging. But we're here today to talk about ways in which we can actually begin to flourish in our workplace. And the last podcast we talked about organisational changes that you can make. And today we're talking about individual things that you can do. With me today are two of my colleagues. I've got Dr. Chao-Yen Chen, who's an anaesthetist in Auckland.
Hello, Sam.
Hi, Chao-Yen. And we also have Lucy Gibbert, who is a GP in Taranaki. Thanks for joining me today, Lucy.
Hi, Sam.
So, Lucy, can you start by telling me about your experience of work and how it's changed over the last 10 years? What do you see in the primary care sector?
Oh, that's a big question, Sam. I think work in general practice has changed significantly in the last 10 years, more probably in the last 20 years, where when I first started, we didn't have the electronic systems that we have now, and results used to come in on pieces of paper. Can you believe it? And actually our inbox was really small. We used to sign off a few sheets of results and specialist letters, sitting with the nurse at lunchtime and just say, oh, can I get this patient back or organise another test for this patient? And that would be my inbox done. Now I am, like many of my colleagues, there at 10 o'clock at night with a task list that's got 100 things on it and an inbox that's pages long, emails from patients, insurance companies, ACC, enormous numbers of correspondences from the hospital about who's on a waiting list and copies of results from all these patients that you don't actually know what's happening and you've got to go and look it up. So I think medicine's become more complex. I think the amount that we do for patients has become much more significant. The amount of medications people are on, the amount of tests that they're having, and I think patient expectations have got higher as well. And with that, unfortunately, funding models haven't necessarily kept up with it. So although there is a huge chunk of our work now that isn't consulting with patients, there's no specific funding for that. So I think that really has put the pressure in general practice, the complexity of the patients we see, and also the complexity of the inbox and the number of things we have to deal with outside of consultations.
Yeah, I remember those paper results and how they used to be sellotaped into the file.
Yeah.
That was the inbox. Chao-Yen, how the hospitals must have changed quite a lot as well. What do you see?
Yeah, I think similar to what Lucy was talking about, patients are definitely more complex. That there's also more obesity, and with that goes all the difficulties of patient transfer and difficulty caring for them. Patients have also spent a lot of time on the internet, and so there's a lot of discussion about different types of treatments, some of which we don't offer in New Zealand. Like you say, expectations are higher. The knowledge that they have access to is broader, but also unfiltered. So I think care is a lot more complex, like you say, to deliver and to meet the expectations for it.
Yeah, so it's not surprising really that burnout is on the rise. So let's think about a definition of burnout, and there are various definitions around, but essentially they all say the same thing, that it's a reaction to chronic stress that results in a sense of detachment, emotional exhaustion, and decreased sense of accomplishment or productivity. And it's measured across 3 domains: emotional energy, depersonalization, and a sense of personal accomplishment. And If you're not familiar with the term depersonalization, it's really characterized by a distorted perception of yourself and others, and it shows up with a lack of empathy, a cynical or negative attitude. Essentially, it's how we push other people away, both patients and colleagues, and I really think that's a self-protective mechanism. The symptoms of burnout are things like dreading going into work, low energy, trouble with your sleep, pulling away emotionally from people, and poor concentration. And it impacts every area of our life. It affects us emotionally, where we might feel like we're a bit of a failure, we get angry, resentful. It affects us cognitively, so we end up with poor concentration, which is why we make clinical mistakes. And it changes our behaviour. I mean, we might be avoiding work, or some of us might have a tendency to become addicted to certain substances. And it affects us physically, of course, because we're tired, etc., and we might be more prone to illness. Chow-Yen, listening to the way burnout affects us, how does that impact us on a medico-legal basis?
Well, I think it will impact us on every way that we interact with our patient and interact with our work, because, like you're saying, medicine, there's a lot of administrative tasks associated with it. And if you're burnt out, when you have your consultation, the patients can tell that you're perhaps disengaged or tired or slightly distracted, thinking about other things. And that can mean that they feel a little bit unheard, or like when they're raising their concerns that you're not really addressing them. And then after the consultation, if you're burnt out and you can't face all the administrative tasks associated with it, you might not be making those onward referrals appropriately, you're not chasing up blood results as diligently as you usually would. That can lead to missed results. And then patients' care can be, as you can imagine, significantly affected if they're meant to be receiving care but don't get their appropriate referrals.
Yeah, I've had at least a couple of cases where the doctors who were essentially feeling very burnt out weren't taking care of their inboxes. And often no one else sees that. It's something that remains hidden until you go on holiday or you go on leave and someone then discovers it. That can be the first sign. So if your inbox is continually overflowing, and let's just say, you haven't checked your results for 6 months, which sometimes happens.
Goodness, really?
Yeah, I've had some cases where significant burnout has led to very lots of not checked results for a very long time. Lucy, do you think that healthcare workers are more prone to burnout?
Well, look, there are some well-defined characteristics that predict doctors' future risk of job dissatisfaction that were noted in the New Zealand Medical Journal, actually, which include introversion, conscientiousness, agreeableness, neuroticism, and low self-esteem. And these traits actually have quite a positive correlation with a high pure IQ. So they're well represented in entrance to medical school. They help their owners pass exams, but then they actually put us at risk later on of burnout. So yeah, lots of those character traits that actually got us into medicine actually aren't so helpful when we're struggling with big workloads and pressures in the workplace. And kind of opposite is true too, that there are some characteristics that actually make people less likely to have burnout, such as resilience, gregariousness, people who have got good self-esteem and assertive and playfulness. But those traits are actually associated with high exam failure rates, apparently, according to the New Zealand Medical Journal. So, actually, those of us that passed, maybe we're actually more prone to burnout. I don't know.
Yeah, I do wonder if we're selecting for people who are more likely to burn out in terms of medical school. But as you say, you do need to be able to pass your exams reasonably well. So we can think that the more I succeed, the happier I will be when we think about burnout. But in reality, it's the opposite. The happier we are, the more successful we will be. And there's a Harvard researcher by the name of Sean Acor who wrote a book called The Happiness Advantage. And he states if we can get somebody to raise their levels of optimism or deepen their social connection or raise happiness, it turns out every single business and educational outcome we know how to test for improves dramatically. So I thought it'd be helpful just to look at these three areas: raising optimism, social connection, and increasing happiness. So let's think about optimism. Chao-Yen, do you think it's possible to become more optimistic? Surely some of us are natural pessimists, or some would say realists.
Yeah, well, I'd like to think that it's a learned behaviour, then I would be more optimistic. But actually, yes, the research does show that we can still learn to be more optimistic, even though we might feel ourselves to be entrenched pessimists. It can be learned. And the good thing is that it's associated with longer life and better health. Gosh, that's really good. And causes increased happiness. So optimism is the way to go.
I think it also makes you luckier. Why do you think that would be?
Well, I guess you're more able to look for opportunities. So then you can take the opportunity, if you like, and then it increases your luckiness.
Yeah. I think one of the ways you can increase optimism is to change the way you approach stressors. When you face something stressful, let's just say a patient's complained about you because they felt you were rude to them, we often jump to thinking we're a bad doctor. We get cynical. We can think, I made such a big effort to help this patient and it's just a thankless job. And, when we think like that, we pull back and we often think about quitting medicine. I don't know about you if you've ever had a complaint, either of you, but the first thing I always think of is, I'm going to quit. I've had enough and I'm going to quit.
I'm a terrible doctor. I shouldn't be doing
that is
this.
exactly how we think, isn't it?
Everyone's going to think I'm awful.
Yeah. I'm not doing that anymore.
Yeah, that's right. And we think, we jump to this thing of we're not very good as doctors, but I'm not sure that we're being entirely honest with ourselves. And yes, sure, we might have made a mistake, even a serious one, but I don't think that means that we are a bad doctor. And if we think about the Swiss cheese model, usually there are many holes that have lined up. It's not entirely your fault. It might have been that you had a really pressured day, you might have a sick child at home, any number of reasons where you might not be on your game that day. And some patients aren't necessarily the easiest to deal with. So I think one of the things to improve your optimism is to begin to challenge our initial belief that we're a poor clinician, because I actually think that we don't always tell ourselves the truth.
Yeah, we're often listening to that negative voice on the shoulder rather than the positive one, especially when we're under a lot of stress and we're tired and we're hungry and there's lots going on. Actually, I think it's easy to have negative thinking. And we often think that everything's bad, nothing's good. And that's actually very rarely the case. But when we talk to ourselves and we listen to that negative voice on our shoulder, we kind of talk ourselves into believing everything's dire. And I think sometimes social media is a bit like that echo chamber of everything's terrible. And look, we have to all admit that there are resource constraints in the health system and everyone is struggling. And look, maybe there are some areas that are definitely dire. But actually, negativity, when we think we'd say, that everything's falling apart, it's going to get worse, everything's terrible. But actually, that may not be the case. And there will be some positives, and we have to look at what the positives might be, that COVID and the lockdowns were all awful, but there were some positives there. They've maybe forced us to work in a different way or more efficiently, and maybe they've introduced virtual consults or e-prescribing. We were just talking about how sad it was we don't get our inbox on a clipboard anymore with pieces of paper, but we used to have to handwrite all our scripts.
That's right.
and actually there are things that have got better, and we have to cheerlead the wins, really, don't we? Rather than just think about the negatives, because it's just too easy to actually concentrate on the negatives, let them go around our mind, and just concentrate on that.
Yeah, I think that's a very good point. It's important to ask ourselves what we're focusing on. What are we ruminating on? What are we allowing to dominate our thinking?
Yeah, I found that something that's quite useful is to keep a thought diary. And what that is where you essentially write down what you're feeling and what the thoughts are leading to that feeling, particularly if you're feeling frustrated or angry or upset. Because we recognize the feeling, but we don't always recognize the thinking that goes on under it. And I think once we begin to realize the thoughts that are going around, we can begin to challenge them. And often it is just a negativity loop going around, and we just need to break into that. So I think, thinking about what we're thinking about is actually a really valuable exercise. And then we can challenge the accuracy of what we're actually telling ourselves. Brené Brown, I don't know if either of you have read her stuff. Yeah. She's fantastic. She's done a lot of work on practicing gratitude. So she's a researcher in psychology. Got a great TED talk if you're interested. Oh. So it's all about practicing gratitude is one of the things she says that produces joy. And I think we can all do with more joy in our lives, can't we? And she says, I don't have to chase extraordinary moments to find happiness. It's right in front of me if I'm paying attention and practicing gratitude. And practicing gratitude, all it is being conscious of even just every day 3 things that I'm grateful for. So especially when you've had just the worst day and you come home and you think, oh, what am I grateful for? It actually changes our thinking. It stops us from thinking about all the negative stuff and begins to switch our viewpoint. Another thing you can try is to send 3 texts thanking people for doing things, because then you begin to think, oh yeah, what do I like about that person? What have they done that's been really good? And I don't know if you've done that, but it actually feels really good to do that. And you can imagine how they feel, particularly if it's one of your juniors at work or something. How good do they feel when they get this text from an SMO saying, what a great job you've done. Thank you.
Yeah, that's great. Yeah, I remember doing the gratitude texts with one of my friends who was going through a rough patch. So for 3 days, we just sent each other 3 texts, 3 things that we were grateful for from that day. And sometimes it was just, my child ate his breakfast.
Yay.
So it was good. It got us through. Yeah, and about the ruminating, and I think I've got young kids, and when I'm exhausted, I just always think, everything they do, I think, oh my gosh, you're so naughty. You're so naughty. But then it's just me seeing them through that tired lens of, you've just tipped the water all over the floor.
Yeah.
I've got to clean it up now.
Yeah, but you'll miss it later when they grow up. And I know everyone says that, but it's totally true. It's totally true. But it is that, how are we looking at those things, and that glass half full, half empty thing where, we do, when there's a complaint, it kind of often fills you up and is the only thing you can think about. But when you get someone saying thank you, you often just let that go. We actually have to learn to actually ruminate on the good stuff and be grateful for the thousands of happy patients rather than the one unhappy patient, really. Because I think with our NPS hats on, we all have assisted members through the years where a very good clinician has been really devastated and at risk of burnout because of one complaint from one patient, where that clinician's a fantastic doctor and has had many, many, many very happy patients, but their world comes crashing down with the one mistake and the one unhappy patient, and I can see why it happens, and it's easy to happen, but actually we have got to understand that there's a lot of happy people out there as well as the one that complains.
I think to a degree that reflects the high standards that we have for ourselves. The difficulty is when those standards are just too high, I guess. But yeah, I can understand. I think most of us go through that same thing, don't we? Interestingly, there's evidence that when we see a problem as a challenge rather than a threat, we get a 23% drop in stress-related symptoms. And we think about these complaints, we talk about them and how we view them. But actually, if we see things as a challenge, we actually feel better. Because remember that I think we run from a threat, don't we? But we actually rise to a challenge. And so I guess my question is, how do we see our difficult patients and our difficult colleagues? Do we feel threatened by them? Or do we actually think this is a challenge that I can overcome? And I think mindset is really important.
And words are important, isn't it? It's using the word challenge rather than, this is, right, I've got a challenge now, I'm going to go for it. Where it's a different thing, isn't it, as you say, than saying, oh, this is just a difficult patient. So let's talk a bit about social connection, because actually when we're stressed, we often pull back. But studies have shown that we do better under stress when we deepen our social connections, so that, we may not feel like talking to people. We may want to shut our door and get on with work, but we're not really coping. We want to hide. But actually, if we can actually reach out, often that we will do better. And Sean Aker, the Harvard researcher, has stated, turns out that social connection is the greatest predictor of happiness we have. When I run them in my studies, when we run social support metrics, they trump everything else we do every time. So actually having social connections and actually having friends in your workplace is a really strong protector against burnout. So how do we actually deepen our social connections? How do we maintain those friendships?
We can, like you say, maintain your close friendships. I know it's hard when you get busy or just get on with your busy lives, but every once in a while your friend sends you a text and says, how are you? And then you think, oh, there you go, they're still thinking about me. Yeah. I'll send one back. So that's always a good starting point. And it's interesting because a good relationship with our boss is also protective. You don't have to be great friends with all your bosses, but having their door open will make a big difference. So if you are in a leadership position in your place of work, try to develop good relationships with your team. Building team spirit is crucial, helps build resilience and lowers patient risk. When we have a good relationship with our colleagues, there's more discussion around clinical issues. We're more likely to ask for help, more likely to help each other, and speak up if we see any safety issues. And we enjoy work more.
And I think that's something we all want, to enjoy our work a bit more.
Absolutely.
Yeah. I think in the last podcast, when we looked at organisational change, we talked about practising civility, and I think that's important. It doesn't, if you're not enjoying your workplace because you feel people are unfriendly, I think it's, you can start, even if it's just you, saying hello to people, good morning, using their name, things like that, and saying thank you to people can make such a big difference. And even if it's not the culture in your department, I think you can actually change the culture around you just by doing those simple things. It's really difficult when someone smiles at you and says hello to not smile and say hello back.
Correct.
I think it's a contagious thing. Mm-hmm. So I think it's worthwhile in terms of deepening your social connections at work. I know that in Sean Aker's research, he talks about increasing happiness, and there was that saying, don't worry, be happy, which sounds so flippant. It's like, yeah, right, just be happy. But are there ways that we can actually build happiness? One of the things that I've thought a lot about is perfectionism. And I suspect that a lot of us are perfectionists, people who get into the healthcare system. Would you agree?
Yes.
Yeah. High expectations of yourself.
High expectations, wanting to be good, wanting to
I will never get a complaint.
Yeah. And because perfectionism really is about relentless striving for unattainably high standards. And even though it's hurting us, we don't stop. Mm. And a lot of it comes out in our self-expectations, but also in our expectations of others. And I don't know about you, but sometimes I find it hard to delegate because you think actually they can't do it in the way that I want them to or to the level that I want them to. Or we can't we procrastinate because it's like, unless I can do it perfectly, unless I can finish it and do it well, then I don't even want to start. So it can come out in procrastination. And then when we get one thing wrong, we end up, I don't know about you, but I beat myself up for a good 2, 3, 5 years, just something like that. You can beat yourself up over something because you got something wrong. But often those things, if you look back, you realise actually in the big scheme of things, those things we didn't get perfect really don't matter.
Yeah, absolutely.
I think there's often, that shame thing as well, that we feel like we don't often see other people not coping, because we often try and hide it when we're not coping. That huge inbox and the, staying up late at night, we often don't talk about it. If we're truly being a perfectionist about it, we don't want to be seen to be struggling. And then that means we don't want to actually communicate with our colleagues that we're struggling, and then we don't get the help we need either. So I think it's really, you've got to actually realise that being a perfectionist, while it's useful in some ways in that, you're going to strive to get things done well, actually you've got to kind of take away the shame if you're not coping. And be able to ask for help.
So how do you overcome perfectionism?
Yeah, I don't know. Sam, how do we overcome perfectionism? Please tell us.
Well, I don't know if you've heard of the 80-20 rule. I think it's a little old school. But the 80-20 rule says that 80% of your results come from 20% of your input. And in order to get the final 20%, in other words, if you want that A+ to get into med school, it's going to soak up another 80% of your time.
Wow.
And it's a truism. Yeah. And did you know that apparently 80% of Microsoft's difficulties or glitches with their software comes from 20% of the viruses they've got, the bugs they've got in the system. And the guy who made up this truism, he realised that 80% of the peas in his garden came from 20% of the pods. Now, what sort of perfectionist is he when he's counting those sorts of things, right? Yeah. But it's a truism, and there are lots of examples of that. So I think if you think about that, you don't have to get A+ all the time. And A is fine. Yep. Getting 80% is fine, and you can achieve that with only 20% of your effort. But if you have to get that perfection, you're spending so much time and energy trying to get there that actually you exhaust yourself, you burn out, and probably not that pleasant to be around. So I guess if you think about increasing your happiness, when is 80% enough in your job? What can you, for lots of, I don't know why, but female GPs tend to correct their spelling mistakes in their notes. As I've done a lot of talking.
I've got spell check, I do, yeah.
Yeah. And it's those sorts of things. A minor spelling mistake that doesn't change the meaning of what you've written down isn't going to be a problem, right? But if you spend all your time chasing those little things, you end up wasting time and energy. So when is 80% enough? I don't know about in your job as an anaesthetist. You probably have to kind of be on your toes a little more than that. But there might be some things for you in your job, Cha Yen, that where 80% is fine. You don't have to have it at 100%. And think about, what soaks up 80% of your day but only yields 20% of your results. What 20% of your work gives you 80% of your enjoyment in the job? Can we just maximise that? What outside of work, what 20% of what you do gives you the 80% of your pleasure? And what 20% of your habits provide 80% of the benefit? So if we think about the 80-20 rule, we're not aiming for perfection. We're aiming for as good as we can get it. So we're aiming for excellence.
Yeah, we're aiming for good enough.
Sorry?
We're aiming for good enough, aren't
we?
Right.
Good enough.
Good enough.
Yeah.
And I often think with referral letters, that's one thing, because you could write the most beautiful referral letter, go back through all the past history, talk about all the current findings, go through all the results. You could easily spend an hour writing a referral letter and make it beautiful. But actually, to get the salient issues that the specialist actually wants to look at and the results, often... Yeah, it might be better if I spent an hour on it, but it wouldn't be that much better. And actually me spending 10 minutes on it is probably going to have a good enough referral letter. I hope. The specialist in Taranaki can tell me if I'm right or not. But I'm working on that. I'm not going to spend an hour writing a referral letter because I just don't have the time, and I can get it good enough.
Yeah, that's right. That's right. Yeah, for example, if you could spend a long time taking a functional capacity history in an anaesthetic clinic, or you could go with them and walk up 2 flights of stairs.
Yeah.
Oh, interesting.
Yeah, 2 minutes or less. Less, 1 minute.
Yeah.
Very good assessment of functional capacity. Yeah.
So I'm sure that there are things that all of us can do in our work life where we can be good enough, with less effort. We just probably need to give it some thought and also release ourselves from the expectation that we've got every T crossed and every I dotted.
Yeah, that's
very, very keen on everybody crossing every T and dotting every I, aren't we? And documenting it as well.
There are some things you have to get 100%.
Yeah, there are.
There are some things you've got to get it right.
Not going to let us off the hook, actually. No. We are going to expect, But I do think it is that whole thing of good enough is still good enough.
Yes.
That's right. C's get degrees. C's get degrees.
Yeah. That's true. That's true. It's really about the wisdom to know which bits you need to put more effort into, get it all sorted, versus I don't need to get this all right. I mean, just think silly things like, you're doing a presentation. Your PowerPoint is your PowerPoint. You don't have to make it really pretty and you don't need to spend all that time on it. There are probably more important things like patients that you need to spend your time on.
Yeah.
So it's those sorts of things. Yeah. But if I'm coming to you and I don't want you to stitch my wound up 80%, thanks. It's got to be 100.
Yeah.
Another thing that you can do to increase your happiness is to develop positive habits. And one of those things is about celebrating success. Because I don't think we're very good at that in health. We tend to, as we've talked about, focus on the negative stuff, the stuff we got wrong or the stuff that's yet to be done. But I think if we can actually stop and celebrate a success, even if all it means is going out and having a coffee or patting yourself on the back, I think that makes a big difference. Because then you begin to, it's like looking at those thank you cards. It's focusing us on the good stuff instead of forever focusing on the stuff we've missed.
I think that New Zealand does have a bit of that tall poppy thing, though, that actually celebrating your own successes is seen as a little bit of a socially inappropriate in New Zealand, isn't it?
Mm.
So I think celebrating your team's successes is probably within your team is probably more acceptable. I don't know. You're right though. We don't celebrate our successes enough.
Mm. I think some other good habits is just making sure you build in downtime into your life.
Mm.
I know for a few years ago I was very stressed at the end of a particular year and didn't know what to do with myself. I was so stressed out and I couldn't wind down. And that's when I took up guitar.
Oh, fantastic.
Late in my life. And I won't say that my playing is pretty, but I enjoy it. And, just doing things like that. Someone told me that actually that's my form of mindfulness because you've got to be present when you're playing an instrument. And I found it really good for my mental health. Mm. And it's been so good. My husband will often say to me, Sam, why don't you go and play your guitar?
Yes.
It's true.
I'm the same with running.
Yeah.
I run very badly, but I run very slowly up hills. That's my way of doing exercise. And now my husband says,
you should go for a run.
You should go for a run.
And you're happy with him saying that? It doesn't.
Yeah, I go, okay, I'll go run up a hill.
You swipe him as you head out the door.
Yeah.
Yeah. But for other people it might be creativity. We've just been to the New Zealand Women in Medicine conference where they have all this artwork.
It was amazing.
By, fellow doctors, and it's incredible. And I think it's important, if you want to build happiness, to actually build stuff into your timetable that feeds you.
That you enjoy.
Yeah. Are there any other things we can do, related to mindset, do you think?
Yeah, I think, the complaints and mistakes and those kind of things, I personally feel, I'm thinking of one particular complaint where I felt completely crushed, and I shouldn't be a doctor one. But actually, honestly, I learned an awful lot from it. And actually, if you do make a mistake or get a complaint or something like that, and you can learn from it and think, right, how am I going to stop that happening again? How am I going to change the way I deal with this particular problem in the future? And do it, actually, it's a bit there has been a good outcome from it, and it does help a bit. I'm not saying it completely gets rid of all those feelings, but it does help. So I think just reframing those complaints and mistakes as, something went wrong there. How am I going to actually do better? And then do it, rather than wringing your hands and looking back all the time, actually look forward to how it's not going to happen again.
One of the good things is, all GPs, of course, belong to a peer review group, but you must have.
We have discussion of morbidity and mortality. Yeah.
But when you get together with a supportive group of colleagues and you discuss your mistakes, you don't hide them, but you talk about them. I think that it removes that shame that you were talking about earlier, because you're bringing it out in the open, and your colleagues are usually so supportive, because we've all had complaints, right? We all know what that's like, and for a lot of us, we just think, phew, I'm glad it wasn't me. It could have been me.
I think it's like playing top trumps, because somebody could always think of something worse that they did.
Yes.
In peer group, I missed that rupturing aortic. I missed that. Dissecting whatever, and I missed this. And, someone can always trump your terrible story of what you did wrong with something else that they've done wrong. And it does just make you feel like, okay,
we're all in the same boat.
We're all in the same boat.
And we can all learn that way. And I think it's getting out of that whole med student on the ward round being questioned and I'm dumb because I don't know the answer, therefore I don't want to let anyone know that I'm dumb. We got to get rid of that. And I think, yes, so learning to embrace mistakes is really important. I think it's hard, but I think it's really important.
Yeah, and it'll deepen your social connections too.
That's true. That's true. One of the things I think that's quite a good thing to address in terms of getting rid of burnout. I think we've talked about thinking about what you're thinking about, but the self-talk of I'm dumb, I'm an idiot, and all those sorts of things. I don't know. Do you label yourself? And often in our thinking, our thought life can become very negative. We go down this negative pathway in the way that we think. And I think it's really good to begin to address that.
And that's that gratitude journal, or the things where you actually think about being kind to yourself and noticing the good stuff.
Yeah, but the reality is none of us are dumb, right? None of us are dumb, but it's so easy for us to believe what we feel.
And we do have to be reasonable in our expectations of ourselves, don't we? We can't be, much as we would love to be, we are not perfect, and we're not going to be perfect.
Yeah. And I think one of the things that would be helpful is if we can practice self-compassion.
Yeah.
Don't think I'm very successful at that yet, but I think it's actually a really good thing to do. We're often, you think about, the way that you would speak to one of your colleagues if they were going through difficulties. And but we often don't speak like that to ourselves.
It's so easy to say it, isn't it?
Yeah.
But when you're actually struggling, it's hard to do it. And that's why we often have to reach out for help. And look, the EAP schemes and those kind of things can be really helpful. Taking a step back is actually really important, because it's all very good on paper and it's all very good when we're sitting here together, but actually when it actually hits you, often that's when you're less able to use those lessons. So I actually think reaching out for help is often what we should really be thinking about as well.
Yeah. So I think there are, thinking about what we've just been talking about, there are lots of things that we can do as individuals to help ourselves in terms of coping with the stress and pressures of the workplace. And And I think what's really helpful is if you just choose one or two things. Maybe it is that you want to begin to celebrate your successes, or you might want to keep a thought diary to work out what is going on in that head of yours, or think about the 80-20 rule. Often we talked about a number of different things, and maybe it's not possible to try everything all at once, but you might find actually just one or two things makes the world of difference.
Don't need to be a perfectionist.
Don't need to be a perfectionist. That is the hardest thing to break.
It is.
But I've been working on that for a very long time.
Yeah.
But it does get better.
Absolutely.
It does get better. And so you can change. You can learn optimism. We can learn to be more optimistic in our approach. I think we just need to put some small but significant steps in place, and maybe they are just positive habits that we can begin to work on. Thank you, Lucy and Chao-Yen, for being vulnerable and talking about building our resilience and hopefully preventing burnout. And thank you to our listeners for listening to this podcast. We hope it's been helpful, and we look forward to catching up with you on our next podcast. If you like the Medical Protection Podcast, please subscribe and leave a review. If you'd like a podcast on a specific topic, please email nzpodcasts@medicalprotection.org. Thanks, Lucy, and thanks, Chao-Yen.
Thank you, Sam.
Thanks, Sam.